parcel is useful in blepharitis, keratitis, Piloticular inflammation of the cornea, corneal opacities, one of the most frequently used eye remedies, acute legionelous inflammation, pustules and ulcerative keratitis with a great intensity of the symptoms, and deep slugging corneal ulcer with the hypopia, corneal abscess, keratoiditis, catarrh and purulent conjunctivitis. Next is the Kali Moor. So, Kali Moor clinically recommended it for the second and exudative stage in inflammations. When there is a characteristics is that there is indolent inflammation and discharges are thick, whitish, fibrinous mucus, dirty white or a grey coat at the base of the tongue. And there is a fibrinous exudation in the interstitial connective tissue and lymphatic innervation. So next one is a mercurius. Mercurius is a most vast large group of the remedies which are the very chronic and constitutional remedies which are useful when there is upper thick lid. Upper lid is thick and red like a sty. So it is a when there is a sty formation, the mercurius is useful, and eyes are inflamed with the swollen tarsi and very sensitive to the touch or light. Lids are spasmodically closed. There is acrid lacrimation and morning agglutination with the eyes are forcibly drawn together with the inflamed swelling in the region of the lacrimal gland. Subjectively, the patient shows that there is a photophobia, gas light, intolerance of the light and firelight, with the heat, redness, and pressure in the eyes with the burning and biting. So, there is a sensation of a cutting substances under the left upper lid and with the dim vision, a fog before one or the both eyes, and eyes drawn together on trying to look at anything and cannot see it distinctly. So, the more she tries, the less able is she restrain the contraction. She is obliged to lie down and close the eyes with the blinded by firelight in the evening. And characteristics are that there is aggravation in the night with discharges are thin sand acrid by the glare of a fire. So it is opposite to the euphoria. Clinically, syphilis is the mark that is useful in a diplocystitis, syphilitic lacrimal fistula, eyes trouble from working over a fire, there is ophthalmia neonatal, then superficial inflammation of the cornea or conjunctiva, catarrhal, phylacticular or ulcerative, conjunctival redness, variable, usually marked, sometimes there is a chenosis, and keratitis, usually from hereditary syphilis, keratoiditis, with or without the hypophysia. So this is useful in episcleritis and blepharitis. And mercurius pains are generally severe, more frequently tearing, burning, shooting, sticking, and not confined to the eyes but extend into the forehead and temples. So, temples often sore to touch and iritis and retinitis. With the choroiditis, with the optic neuritis is useful in mercurius. So, in a phosphorus, there is a objectives are eyes are sunken and surrounded with the blue ring. Eyes seem large. There is edema of the lid around the eyes, ptosis, myopia, and subjectively the patient feels that there is a aching and burning pain in the eyes with the stiffness and heat, with the dull pain after reading. Visions objects look red, letters look red when reading. There is a hemerotopia, day blindness, sees more distinctly in twilight than during the day, with the eyes give out while reading. Characteristics are that there is a very sensitive to the external impression and clinically blepharitis, keratitis, corneal opacities, myopia due to or increased by ciliary spasm and have been reduced perceptibly with the 2x interval. So it is useful. Phytolacca is useful when there are leaves are inflamed, swollen, hard, reddish blue, edematous, left in the morning and leaves are agglutinated with the lacrimation. Subjectively, the patient shows that there is photophobia and pressure around the eyes in the afternoon and as if they were too large and smarting, sandy feeling in the eyes. Eyes feel as if granulated and the edges feel scalded, hot as if raw. So there is a dull aching pain in the eyes with the motion, light or exercise. An aching pain along the lower half of the right orbit. The characteristics is that there is a weakness and tired aching and soreness generally all over the body with the stony hardness of the bluish inflammation of cellular tissue. Then clinically it is useful for the orbital cellulitis. Leaves are hard, swollen, reddish blue without a severe pain. There is a chemosis, more or less dull aching pain, panophthalmitis and suppurative choroiditis with the blepharitis. So it is useful for the physostigma. Physostigma is useful when there is a follicular conjunctivitis, staphyloma after a suppurative inflammation, increasing myopia, contraction of the pupil, twitching of ocular muscle, night blindness, photophobia, glaucoma, that is the flashes of the light, partial blindness, paresis of accommodation, profuse lacrimation, astigmatism, spasm of ciliary muscles, and irritability with after using the eyes with the post-diphtheric paralysis of the eye and accommodation muscle. So, in the pulsatilla shows the eye complaint when there is a thick, profuse yellow and black discharges and with the itching and burning in the eyes with the profuse lacrimation and secretion of mucus with the lid are inflamed and obliterated. With the corneal opacities, styes, vein of the fundus are oculi and greatly enlarged. There is ophthalmia neonatorum, blepharitis, subacute conjunctivitis with the dyspepsia. Worse in a warm room, heat, rich fat food after eating and towards the evening. So it is better in open air, motion, cold application and cold pools. So pulsatilla is useful remedy in, in eye complaint when there are such. Next one is the sepia. So sepia is useful in muscular asthenopathy. Black spot in the field of vision. Then there is the aesthetic inflammation in connection with the uterine trouble, aggravation of eye trouble morning and evening with the tarsal tumor and ptosis, ciliary irritation, venous congestion of the fundus and blepharitis. So sepia is useful in these conditions. Next one is the cilicia. Angles of the eyes are affected and swelling of the lacrimal duct with the aversion to daylight. It produces a dazzling, sharp pain through the eyes and eyes are tender to touch and worse when closed. So vision are the confused and letters are run together on reading and it is useful in a style. So silicia is useful in styles when there is a iritis or iridochoroiditis with the pus in the anterior chamber and perforating or slugging ulcer on the cornea. Then there is a abscess in the cornea after the traumatic injury cataract in office worker with the blepharitis, and after the effect of keratitis and corneal ulcer with clearing the opacity, and use the 13th potency for the month. Sulfur. Sulfur is useful when the objective shows that there is a lacrimation in the morning with the burning followed by the dryness, swelling and pain in the lid with the lacrimation. The eyes are dry in the room with the lacrimation in open air. Lids are red, swollen in the morning with the redness of the lid and conjunctiva. There is an eruption of the pimples on upper lid with the heaviness of the eyes, morning agglutination and nocturnal lacrimation. It shows sulfur. With the redness of the eyes during the day, violent itching in the evening with the inflammation of the eyes or lids, with the swelling redness of the conjunctiva. A white vesicle on the white of the eye close to the cornea with the purulent mucus in the eye. Subjectively, there is a much itching in the brows and tip of the nose of the lid with the burn. Then there is a dryness of the inner surface of the lid with the burning, dryness, smarting, itching of the lid margin, morning aggravation, sandy, sticking and burning in the outer canthi with the pricking in the eye causes one to scratch and rub them. Biting of the eyes and lacrimation very often, a feeling of heaviness and itching in the eyeball when reading or writing. So characteristics are that works after the washing, bathing, early morning sulfur burn is loreal chiefly in chronic diseases, but it is none of the less important in acute conditions or as an intercurrent remedy. It is especially useful for the people subject to the skin eruption and after such a eruptions have been suppressed even many years before by local treatment and sharp darting pain like a pea press. Next one is a delirium. So when the lid are thickened, inflamed, itching, there is a pterygium, pustular conjunctivitis with the cataract following the ocular region and aids the absorption of infiltration in the iris and choroid with the blepharitis, then delirium is useful. So next one is a rust. When swollen red edematous orbital cellulitis with the pustular eruption and photophobia, profuse flow of yellow pus, edema of the lid, suppurative iritis with the lids are inflamed, agglutinated, swollen, glaucoma, old injured eyes, circumscribed corneal injection, intensive ulceration of the cornea with the iritis and after exposure to the cold and dampness of the rheumatic origin, eyes are painful or turning wet or pressing. And there is a profuse gush of the hot, scalding tear upon the opening the lid, which is worse by wet, rainy weather, night and during the rest, and better in a warm and dry weather. So, rust off is useful when there is a corneal inflammation due to the foreign bodies with the phalangicular keratitis and staphyloma after a suppurative inflammation of the cornea with the corneal ulcers and blepharitis. So, after the rust talk, we can learn about the thuja. Thuja is a useful nocturnal agglutination, pimples on the lower lid margin, styes, on the right eye, white on eye with the much inflamed, and subjectively tearing pain in the left brow which disappear after the touch, lids feel swollen and as if a foreign body were in the eye, and burning and stinging in the edges of the lid with the evening, and in the eyes with the injection, eyes feel dry, sandy, and pressure in the eyes. A painful stitch through the center of the left eye, commencing in the center of the brain. So the last one remedy is the upas stimulate, that is upas free and synchronous stimulate produces the tonic spasm, tetanus, asphyxia, pain in the eyes, and orbit with the conjunctivitis, dull sunken eyes, styes, and blepharitis. So this is all about the upas stimulate, and this is the end of the topic, that is the homeopathic therapeutics of the diseases of the eyelid. So today we stop here and we completed the homeopathic therapeutics of the diseases of the eyelid, and for the next lecture we will study about the diseases of the lacrimal apparatus. Till that, have a good day and all the best.